How you doing today, sir? My name is Jacob, and I'll be your respiratory therapist for the day. I'm sorry to hear about your recent prognosis of histoplasmosis. However, you do bring up a good question. What is histoplasmosis? Histoplasmosis is a fungal infection caused by the inhalation of the spores of the fungus Histoplasma capsulatum. Oftentimes, this fungus is found in soil, especially in areas where bird and bat droppings are the highest. This could be caves, old buildings, old barns, even attics. In your case, you are a farmer and you are around chickens a lot, so this is the likely cause of your infection. This infection affects 1 to 2 people per every 100,000 annually, so it is relatively rare. However, it's important that we take the right preventative measures and do the right treatments to ensure that you heal properly. Yeah, changes you might see in yourself. So, oftentimes, ex- after first exposure, you might not get signs or symptoms until about 17 days after. And if this is a super mild case, you might not even have symptoms at all. However, if you do have symptoms, they're likely to be similar to the everyday flu. So these things could include a fever, chills, headaches, muscle aches, and fatigue. However, since you do have a pre existing lung condition and are immunocompromised, you might experience more severe symptoms. These include bloody cough, night sweats, weight loss, and another name for this is chronic histoplasmosis. Like I said, you do have chronic bronchitis, so you do fall under this category. So I just want to make you aware of that. And I know you aren't severely immunocompromised, but I do want to let you know about what this can potentially lead to. And that is something called disseminated histoplasmosis, which is most common in extremely immunocompromised patients and infants. But some of these symptoms can incur a high fever, a cough, shortness of breath, skin lesions, and then affected organs, especially the liver and the spleen. And once those organs are affected, this can cause a cascade of issues, causing your whole homeostasis to be off. But hopefully, we can get to preventative measures and do some therapies to help you avoid to even getting to that point. Yeah, so since histoplasmosis comes from breathing in fungal spores, often found in the soil where those bird and bat droppings are, it's important that we limit our exposure to these areas completely. In your case, I know you do work on a farm to make a living, so if it's absolutely necessary, some things you could do could involve wearing an N95 mask, even a face shield, long sleeves, to help prevent yourself from breathing those things in, as well as putting wet soil on top of infected soil. That way, it masks the spores from even coming up. Even though that's only a temporary solution, you could also get a cleanup team or an infection control to come out there and to clean your area up for you. That just might be a little bit more pricey. And then dusty environments as well. Avoid any kind of dusty environments because anytime the spores can easily get up in the air, it makes you more susceptible for breathing those in. Yeah, so similar to the other questions you asked, the treatment options for histoplasmosis are going to be fully dependent on the severity of the infection. Like I mentioned before, mild cases, you won't need any kind of treatment option at all. The infection will go away on its own. However, you do fall within the moderate infection category, so we will need to do some kind of treatment. And that treatment happens to be an antifungal medication taken orally called intraconazole. So, what's interesting about this medication is it's over a course of several months that you'll have to take this. Unlike the standard flu, where you take an antibiotic for a week or two and then it's gone, fungus, especially the plasmosis fungus, is super resistant and stubborn to certain medications. So it takes several months for this to clear up. And then if this does turn into something serious, such as an infection where it goes to different organs in the body, we will need to take a different antifungal called amphotericin B, and that's given through IV at the hospital, so you'll need to come in for that. And then as you progress throughout these antifungal treatments, it would be wise to have supportive care as well, and different types of therapy. For example, the flutter valve, if you have a lot of secretions in your chest, or if you have someone or somewhere you can go to receive any kind of percussion therapy, where the therapist, like myself, could do CPT on your back or break up any kind of secretions that way. And then throughout this, we're going to want to monitor you now, during the treatment, and during the medication, and then after it's said and done too, to see how you're progressing. Because we don't want to keep you on the medication longer than we have to. Yeah, there are some things that you need to schedule moving forward from here. First and foremost, not all of these are going to apply to you. However, I'm going to lay everything on the table. That way, you have all options in front of you. It's important that you see your primary care provider so they can evaluate your systems and then refer you to other specialists. For example, they might refer you to an infectious disease specialist. They happen to have a better knowledge base on diseases like histoplasmosis that are so rare. And then, since you are experiencing some respiratory issues as well, it's important that you see a pulmonologist, which we could refer you to look at your lungs at a more in depth way. They might do things like a bronchoscopy where they go in or they suction any kind of secretions out to help you breathe better and help your lung function to improve. But that's just all hypotheticals, but you want to have those options available as this disease can potentially progress. And then in more severe cases, histoplasmosis is known to cause eye issues, so they might refer you to an eye specialist as well. And then any other kind of therapies you need to do. So if it does become more severe, you will have to schedule those IV antifungals to come into. Or if it's more advanced therapies, like you need to come in for uh, CPT, percussion therapy, but that'll likely be done at home with the flutter valve, like I mentioned before. Good question. So, if any of your symptoms become persistent, so after we start these therapies and your symptoms don't go away, at least within a couple of weeks, it's important that you come back in so we can take a further look at you as well. Or if any new type of symptoms happens to occur, it's important that you come in immediately. This includes if you notice that the infection is spreading to different parts of your body. I know this can be hard to visualize or to know, but if you experience anything new, it's really important that you come in so we could take a look at you. Another thing I want to mention is if you are re-exposed to the histoplasmosis or you feel like you have been, it would also be wise for you to come in so we could take care of you and just evaluate you to make sure that nothing has progressed any farther. If you're looking for some more information on histoplasmosis, I recommend visiting the Centers for Disease and Control Prevention or the CDC's website. They have a comprehensive section that's dedicated to the study on histoplasmosis, stating different things that include symptoms, causes, prevention, and treatment options. This site is a pretty reliable source that could help you understand the disease a little further. Again, it was nice meeting you today, sir, and I wish you the best of luck moving forward.